All right, let's jump into this. You've sent over some really interesting stuff about medical education and healthcare access in India. It seems like you're trying to grasp some pretty big problems from how doctors are trained to if people can actually get the medicines they need.
Yeah, absolutely. There are sources here that look into the recent changes in medical education, the very real shortages in healthcare workers, and the often confusing world of pharmaceutical pricing and how that's regulated.
Exactly. We've got three key areas: the reforms in how doctors are trained, the shortage of people actually giving care, and the whole complex thing about getting and affording medicine.
And what's really fascinating is how these three things, seemingly separate areas, they're all kind of running into the political realities of a country as big and complex as India.
Your mission, if you choose to accept it, and you have, is to really wrap your head around the core problems and what people are suggesting as solutions, especially where politics comes in. You want to go beyond just the headlines and really understand the sticking points and what could actually make a difference on the ground.
So our goal is to really break down these sources for you, get to the most important takeaways, and understand how political forces are either helping or hurting progress in Indian healthcare.
Right, let's dive in. First up, how are the doctors of the future being prepared? This first source lays out some pretty big recent changes, like NEET, that single national entrance exam for medical schools, and the National Medical Commission now in charge of overseeing medical education. We should also touch on the rules for doctors who got their training abroad, and that district residency program, which sends doctors to work in rural areas.
It's the ambition of these reforms that's really striking. It's a real top-to-bottom reshaping of medical education. NEET, for example, was supposed to create a level playing field for anyone who wants to be a doctor across the country, but that push for uniformity across the nation, it immediately raises questions about how that works in India's very diverse educational landscape.
This is where you see a political fault lines with these reforms. The source really highlights that tension between states wanting to keep control over their education systems and the central government pushing for standardization through NEET. There are some real arguments being made about whether NEET unintentionally favors students from the CBSE board and creates a language barrier for students, especially those from non-Hindi-speaking states like Tamil Nadu.
That tension between centralized control and how much power states have, it's a constant thing in Indian policy, and education is a perfect example. The concern that NEET puts state board students at a disadvantage comes from differences in what they're taught, potentially making it harder for them in a national exam. And the language issue is about basic access, making sure talented students aren't shut out just because they don't speak a certain language.
Then you have the whole issue of regulating private medical colleges. And there's definitely pushback politically on the NMC trying to control fees and admissions there. Plus, that mandatory rural service requirement, while it's a good idea in theory, it's not exactly loved by everyone, with doctors raising concerns about the facilities and the pay in those rural postings.
Private medical schools play a huge role in India's medical education system, and debates about how much the government should be involved. Especially when it comes to costs, it always gets political. In the same way, the district residency program, it's meant to address a critical need, more doctors in rural areas, but it runs into some real-world challenges. Without proper facilities and fair pay, these postings can be really tough. Leading to resistance, it makes you wonder if the policy's good intentions are being backed up with the resources needed to make it work.
So what are some of the way forward that the source suggests? Keeping in mind this political reality, it seems like it's calling for more political cooperation, maybe making NEET more flexible, with support for regional languages and different syllabuses, giving states a bigger say, while keeping some national standards, and maybe even joint funding to create more affordable medical school spots. Transparency in admissions, and addressing social and economic inequality are also seen as crucial.
These suggestions really show the need for a more collaborative and nuanced approach, finding a way for NEET to respect India's linguistic and educational diversity, while still making sure there's a basic national standard. That's key. Getting states more involved in shaping these policies, together with financial support from the central government, could lead to a system that's both fairer and more effective. And as the source emphasizes, fairness and equal opportunities in admissions are essential for building trust and making sure medical education serves everyone in society.
When you look at the bigger picture, the source argues that if these medical education reforms are done right, it could mean more doctors for everyone, fewer talented people leaving the country, more foreign investment in the sector, and even more jobs in healthcare-related industries.
Absolutely. Having a well-trained medical workforce that's spread out fairly isn't just about healthcare. It has a big impact on the economy as a whole, stopping that brain drain where talented doctors leave for better opportunities elsewhere, and attracting investment in medical research and education. It can create a positive cycle of growth and development.
Okay, let's shift gears now to the second source, which really highlights just how bad the shortage of doctors, nurses, and paramedics is across India. We're talking some pretty worrying numbers here, like a doctor-to-patient ratio. That's way below what the WHO recommend, around one doctor for every 1,500 people instead of the ideal 1 to 1,000, and a shortage of over 2 million nurses. The fact that 75% of doctors are in urban areas, while 70% of the population lives in rural areas, that's a huge gap, and the lack of trained paramedics is a major weakness, especially for emergency care.
These numbers really show the immense pressure on the existing healthcare system. The sheer lack of healthcare professionals, especially nurses, it's alarming. And the concentration of doctors in cities, it highlights a fundamental inequality in who can get care, leaving a lot of the rural population underserved. The lack of paramedics also shows a weakness in being able to respond quickly to medical emergencies outside of cities.
This source also points to some political and structural reasons for these shortages. It talks about political resistance and funding delays when it comes to expanding medical and nursing colleges. There are also those ongoing disagreements between states and the central government about who should pay for developing the workforce. Low wages and a lack of job security are pushing healthcare workers to look for opportunities abroad. And surprisingly, there are restrictive licensing policies that make it hard for Indian doctors trained in other countries to actually practice in India. Plus, there aren't enough good incentives to get people to work in rural areas.
This really shows how political and administrative hurdles can make a bad situation even worse. Arguments about who's responsible for funding and bureaucratic delays can really slow down how quickly we can expand those crucial training institutions. The problems of low pay and no job security, they're big reasons why healthcare professionals are leaving the country. And the licensing problems faced by doctors who trained abroad, it seems kind of backwards given the shortages. It makes you question if the current policies are really serving the country's needs. And finally, without good incentives, it's really hard to convince healthcare workers to go and serve in rural and remote areas where they're needed the most.
The solutions suggested here again emphasize political collaboration, increasing funding, and the number of spots in government medical colleges, especially in underserved areas. That's key. Public-private partnerships to expand training capacity are also mentioned, to get people to work in rural areas. The source suggests better salaries, housing, and chances to move up in their careers, streamlining the licensing process for those trained abroad, and making paramedic training stronger through government-backed vocational programs. Those are other steps being proposed.
These solutions really highlight the need for a multi-pronged approach that needs both political will and coordinated action. Investing in public medical education, using the resources and knowledge of the private sector, creating real incentives for working in rural areas, and simplifying the process for qualified professionals to join the workforce. These all require different levels of government and a lot of different groups to work together. Strengthening paramedic training is also really important for building a stronger, more responsive healthcare system at the community level.
If we think about the wider impact, investing in the healthcare workforce could really change who has access to care, bring down death rates, potentially boost India's medical tourism sector, create jobs, and generally make the healthcare system more resilient when facing challenges.
Absolutely. Having enough healthcare staff doesn't just lead to better health and save lives, but also has big positive effects on the economy, including attracting patients from other countries who are looking for quality care and creating much-needed jobs within India. Having a strong workforce is also key for dealing with public health crises effectively and building a healthcare system that can last into the future.
All right, let's move on to the final piece of the puzzle, the often very complex world of pharmaceutical pricing and regulation. This third source really shines a light on how the high cost of essential medicines, regulatory hurdles, and political disagreements between the central and state governments are causing some serious problems.
Yeah, the pharmaceutical sector is a critical part of healthcare, and making sure people can get affordable medicine is really important. But the mix of market forces, government rules, and politics, it creates a very complex and often difficult situation.
What's really interesting here is seeing all the different things that affect the cost of drugs. You have the National Pharmaceutical Pricing Authority, the NPPA. They try to regulate the prices of essential medicines. But these price caps can sometimes lead to shortages. Then you have the high cost of patented drugs, which puts a lot of life-saving treatments out of reach for many people. Even though India is a big producer of generic drugs, there are still problems with quality control and disagreements about pricing. And the fact that some states give subsidies for medicines while others don't, it creates a real patchwork of different prices across the country.
This really shows how delicate the balance is in pharmaceutical policy. While price controls are meant to make essential medicines more affordable, sometimes they can have unintended consequences on supply if manufacturers think they won't make money. The debate about patented versus generic drugs, it's a global one, with this constant tension between rewarding innovation in the pharmaceutical industry and making sure everyone can get the treatments they need. And the differences in state subsidies, it just shows there's no single national strategy for making medicines affordable.
And the political and regulatory landscape, it seems just as complicated. State governments often push back against pricing rules set by the central government, probably because of pressure from local drug makers. There's this constant back and forth between trying to keep drug prices low and wanting to encourage pharmaceutical companies to innovate and come up with new medicines, intellectual property rights, especially patent laws, and the idea of compulsory licensing. That's another political hot potato that affects how affordable medicines are. And the source isn't afraid to mention how lobbying might influence which drugs get price controls or are approved by regulators.
These political and regulatory challenges are big. The different priorities and pressures that the central and state governments face can lead to a fragmented and sometimes even contradictory approach to pharmaceutical policy, finding that sweet spot between controller prices and encouraging research and development in the pharmaceutical industry. It's a constant struggle. Intellectual property laws, they directly impact when generic versions of drugs can be sold, which of course affects their price. And the influence of lobbying just underlines the fact that the pharmaceutical industry, like a lot of others, operates within a political system that can shape what happens with regulations.
To try and untangle this, the source really stresses the need for political rivals to find common ground. This could mean coming up with one unified drug pricing policy that both the central and state governments can agree on. Public-private partnerships might be a way to improve access to medicines, policies that support local drug research and development. While still keeping affordability in mind, are crucial. Strengthening regulatory oversight to prevent corruption and make sure pricing is fair is also vital. And expanding that network of Jan Aushadi Kendras, those government-run generic drugstores, could make affordable medicines much more available to everyone.
These solutions really show that we need a more coordinated and comprehensive approach. Having a single national policy for drug pricing would provide some much-needed stability and predictability in the market collaborations. Collaborations between the public and private sectors can use the strengths of both to improve access to medicines and encourage innovation, supporting drug research and development here in India, while also thinking about affordability. It's key for India to stay a leader in the global pharmaceutical industry. Stronger regulation is crucial for ensuring the quality of medicines and fair pricing. And expanding initiatives like Jan Aushadi Kendras can provide a vital safety net by making affordable generic medicines more accessible to people.
When you look at the big picture, again, a well-regulated pharmaceutical industry can not only improve access to essential medicines, but also strengthen India's role as a major global supplier of pharmaceuticals, attract investment for local manufacturing and innovation, and ultimately help the healthcare system and the whole economy to be sustainable over the long term.
Absolutely. Having a strong and well-regulated pharmaceutical sector isn't just about public health. It's a major driver of economic growth, and it improves India's standing in the world.
So as you can see, you've really dug into a really interconnected set of issues around medical education and healthcare in India. What's striking is just how much these challenges are tied to politics. Whether we're talking about standardizing how doctors are trained, tackling the shortage of healthcare workers, or making sure people can afford essential medicines, the same theme keeps coming up: the absolute need for different political players to find ways to work together.
Exactly. Each of these areas, while having its own unique set of challenges, is fundamentally influenced by the political landscape and how well different levels of government and various political groups can find common ground and cooperate.
We've seen how disagreements over things like central versus state control language use in education, how to regulate private companies, where funding should go, and even intellectual property rights can create big roadblocks. But the sources also offer some hope. suggesting possible ways forward that depend on political cooperation, flexible policies, strategic investments, and clear, transparent processes.
The potential for real progress is definitely there, but it hinges on being willing to put the well-being of people first and finding solutions that go beyond partisan divisions.
This deep dive really shows that the future of healthcare in India isn't just about the latest medical advances or economics. It's fundamentally tied to whether policymakers can bridge their differences and work towards a shared vision for the nation's health.
In the end, a healthier India needs a politically unified approach to tackling these systemic challenges.
So here's something to think about. Given how deeply ingrained these political dynamics are, what's one small practical step that could realistically encourage greater cooperation between political parties on even just one of these complex healthcare issues? Maybe focusing on a very specific area where there's a clear benefit for everyone, something less likely to cause immediate political pushback. It's a question to consider as you continue to learn about this really important topic.